Good evening everyone. I am Malarvizhi, Assistant Professor, Department of Medical Surgical Nursing. I am going to talk about endocarditis. Introduction of endocarditis. It is an infection of the heart inner lining, usually involving the heart valves. Endocarditis it usually occurs when germ from elsewhere in the body travel through the blood and attach to the damaged area of the heart. Definition of endocarditis. It's nothing but infections of the inner lining of the heart like endocardium. It's caused by direct invasions of the bacteria or other organism leading to deformity of the valve's leaflet. Types of endocarditis. There are two types: non-infective endocarditis, infective endocarditis. In non-infective endocarditis like a rheumatic endocarditis and variceous endocarditis with a systemic lupus erythematosus is one of the autoimmune disorder, and non-bacterial thrombolytic endocarditis. And infective endocarditis like acute infective endocarditis, subacute infective endocarditis. Predisposing factors like congenital heart defects like ASD, atrial septal defect and ventricular septal defect. Damaged valves by rheumatic fever and atherosclerosis. Any deposition like fat depositions in the arteries and artificial heart valves like stent replacement, and after cardiac surgery invasion procedure like dental procedure, catheterization, IV therapy and minor surgery and gynecological examination and dialysis. Infections of tonsil, teeth, skin, lung and GI tract, and immune compromised patients and IV drug abusers. These are the predisposing factors. Causes of endocarditis: dental procedure and degenerative disease. Unlike a dental procedure like teeth remove and degenerative disorder and resistant to the antibiotic, untreated strep throat infection and rheumatic fever, and major cardiac surgery CABG, and stitching into the dirty needle and medical instruments. And against once they are using the needles and syringe, against they are not at all following the aseptic techniques. That's why they have to infecting to the needles. Infectious agents like para-influenza and Apherophilus, Parapherophilus, Actinobacillus, Actinomycetum commitans, Cardiobacterium communis, Echinella corrodens and Kinchella. These are the infective agents that will be affecting to the endocardium. Pathophysiology of endocarditis. Due to the etiological factors like bacteria enter into the bloodstream, this leads to colonization, replications of the bacteria and the valve's leaflet. This leads to bacteria get surrounded by the fibrin and platelets, forms vegetation and clot travels to the other organ forming abscess. The bacteria get surrounded by the fibrin and platelets, form vegetation and clots that will be travel to the other organs forming like a abscess formation. This leads to damaged heart valves by perforating and deforming valves leaflet. This leads to causes infections of the organs in the heart, decreased blood circulation and oxygen circulations into the heart, kidney, spleen or lungs. This leads to deposition of vegetations over the valves. Non-specific manifestations like fever with chills, malaise, weakness, fatigue, anorexia, arthralgia, myalgias, back pain, abdominal discomfort, weight loss, headache and clubbing of fingers. These are the non-specific manifestation. Peripheral manifestations like petechia is a small pinpoint hemorrhage in the conjunctiva, mucous membrane, neck and ankles. Peripheral manifestations like a rat spot, the boat-shaped retinal hemorrhage near the optic disc seen in the fundoscopy. It results from microemboli of the optic disc. And Osler's note, red painful nodes with a white center of the pads of fingers, toes, palms or soles, and it's a late signs of infections of endocarditis. Chanivis lesion, it a flat, painless red to bluish red spots on the palms and soles and rarely signs of endocardial infection. Splinter hemorrhage, appearance of small dark lines under the nails. Clinical manifestations, cardiac manifestation like a heart murmur sound with aortic and mitral valve is most commonly affected. And secondary embolization, embolization in spleen, sharp at upper quadrant pain and splenomegaly, enlargement of the spleen and local tenderness, it will be happen. In kidney, flank pain, hematuria and glomerulonephritis, and brain, hemiplegia, ataxia, aspasia, visual changes and change in the level of consciousness. Diagnostic evaluations, what are the diagnostic evaluations that will be taken from the endocarditis, like a history collection and physical examination, complete history and physical examinations done to the patient in laboratory data, blood culture and sensitivity to identify the organism, which organism that will be enter into the bloodstream, the best test for detection obtained sample just before and during height of fever, CBC, ESRI, WBC, anemia, ECG and chest X-ray. These are the investigations to take the endocarditis. Cardiac catheterizations, echo, 2D echo, valvular vegetation and transesophageal echocardiograms, digital imaging, 3-dimensional transthoracic and echocardiogram. And Duke's criteria, major criteria and minor criteria. There are 2 criteria. In major criteria like a blood culture, positive serial and endocardial involvement, echocardiograph, identification of vegetation, if presence of any abnormalities in the endocardium, new vascular insufficiency, decreased oxygen and blood circulations into the endocardium. These are the major criteria. In minor criteria, predisposing cardiac conditions like a fever, vascular symptoms, immunologic and microbiologic, echocardiogram. These are the minor criteria. Complications like a congestive heart failure, most common due to damage to the aortic mitral valve. And embolic episodes, ischemia and necrosis of organs, arrhythmias, atrial fibrillation, glomerulonephritis, stroke and brain abscess. These are the complications of the endocarditis. Complications, congestive heart failure is most common due to damage to the aortic mitral valve. In embolic episodes like ischemic, decreased oxygen supply and blood circulation, and cell death will be presence of the endocardiums. Arrhythmias, atrial fibrillation, glomerulonephritis, stroke and brain abscess. These are the complications of the endocarditis. Medical management, organism with the streptococci may be treated with the penicillin G at 12 to 18 million per day, IV by in 6 equally divided dose for 4 weeks. Ceftriaxone at 2 grams per day, IV for 4 weeks. Gentamicin at 1 mg per kg every 8 hours for 2 weeks. They will be starting for medical treatment. The organism with the fungal infection are treated with the antifungal such as amphotericin, for example for Abilict and ampicillin. Clindamycin is the drug of choice for patients with the penicillin, ampicillin, ceftriaxone, vancomycin, amoxicillin and nafcillin. Azithromycin, cefazolin, cephalaxin and clarithromycin. These are the drugs to treat the endocarditis to prevent the bacterial or fungal infection. Surgical management, debridements of vegetation, closures of the fistula like a congenital defect, that will be closure of the fistula, excision and replacement surgery of the endocardium, drainage of abscess, repair of peripheral or cerebral mycotic aneurysm. The surgical repair of valvular deformities and congenital defect of the endocarditis. Supportive managements, Advice to the patient to take a complete bed rest. Repeating cultures they will be taken from the patient. Nutritional supplement, and they should be followed for patients with a prosthetic valve require caution. Anticoagulation, because anticoagulant therapy does not reduce the risk of embolization and have intracerebral hemorrhage risk. Nursing managements. What are the nursing managements? Like the nurse monitor the patient temperature, normal or baseline cardiac function like a heart sound assessed. A new or worsening murmur may indicate their signs of prosthetic valve rupture of an abscess or injury to the valve leaflet. Maintaining adequate cardiac output and tissue perfusion and post-operative care and instructions they should be educated to the patient. The nurse monitor for signs and symptoms of systemic embolization. In addition, the nurse assesses the signs and symptoms of organ damage such as a stroke, meningitis, heart failure, myocardial infarction, glomerulonephritis and splenomegaly, enlargement of the spleen. In all invasive line and wound must be assessed daily for redness and swelling, any worsening of the surgical site. After discharge, the monitoring IV antibiotic therapy delivers in the home setting. During the course antibiotic treatment, performance of ADL and knowledge of therapeutic regimens. These are the things that will be educated to the patients and also family members. Thank you.